was quite a vulnerable young adult. I left home at 16. I was really attracted to heroin. It just seemed to have like a really dark glamour to it. I didn't know how to be in the world, and if I took drugs, it removed me from feeling awkward or vulnerable or feeling shy with people. I got something to hide behind. Heroin's the biggest painkiller of all. And nobody ever, I think I must have been 40 when I realised that. I didn't realise I was taking a painkiller. Edinburgh became the AIDS capital of Europe within 2 years because there was no programmes for anybody and we were denied needles. So they created these places where everybody was using the same needle. Roughly the same time that we were going through all that in Edinburgh, in Switzerland, the president, Ruth Dreifuss, decided to take a completely different attitude. She treated heroin use as a health issue. And I think what happens is when you treat somebody as a human being that's got a health issue, they realise that the fight's internal. And then they can make positive life changes and choices. If they'd been injecting sites here, I wouldn't sit with people's children who lost their mothers at 5 years old and then went through the care system themselves and then became addicts. I don't think I would be seeing generational drug use in the way that I do in Edinburgh. Long-term consequences of my drug use, and I haven't used heroin since I was 21, have been there's certain countries I'll never be able to live in. I have HIV and I have a profound sadness that things could have been different. I mean, for me, for somebody who drugs are really dangerous, that's why I want them regulated, because they are really dangerous. And it's really irresponsible not to take control over dangerous substances. But the biggest barrier for anyone getting into and maintaining any kind of recovery is the current drug policy.